Good morning, everyone. My name is Sara and I will be presenting on my project, Aboriginal Knowledge and Ways of Knowing, an environmental scan of organizations and literature. First, I would like to acknowledge that we are guests on the traditional territories of the Coast Salish and Strait Salish people. About me. I am in the Masters of Public Health program focusing on Indigenous people's health. Locating myself within the context of Indigenous people's health is an important element of decolonizing my research and recognizing my own privilege and position. I am a daughter, a sister, a wife. This picture is a way of me to honor my family. I am of settler ancestry, as my ancestors came from North America, from Scotland and Ireland. My ancestors were farmers searching for a better life for themselves and their families. For the majority of my life, I have lived on Coast Salish territories. My husband is of Tla'amin and Irish ancestry. My journey in the public health program has been a journey of personal growth for both of us and our families. My practicum organization was with the Centre of Aboriginal Health Research, which is a research center affiliated with the University of Victoria. The center seeks to promote, facilitate, and lead relevant and ethical health research that builds on the strengths of Indigenous peoples and improves Indigenous peoples' health through engagement with stakeholders in BC, across Canada, and internationally. CAR is part of a larger network of research centers called the Aboriginal Health Research Network Secretariat. The Secretariat is the coordinating body for the 9 network environments for Aboriginal health research known as NEAR centers, which are located across Canada and shown in this map. I'll give you 10 seconds to read all the names on it. The Secretariat is currently funded by the Canadian Institute of Health Research until 2017. The purpose of the Secretariat is to enhance collaboration with researchers, students, national Aboriginal health organizations, and international Indigenous networks. The Aboriginal Health Research Network Secretariats, or ARSNets, Aboriginal Knowledge and Ways of Knowing project, known as Aqua, is envisioned as an open access, web-based resource of diverse materials, including peer-reviewed journal articles, government and non-government organization reports, multimedia, for example, videos and podcasts, and community material, which will be hosted on the ARSNet's website. To clarify, the term Aboriginal is used as part of the project name due to funder requirements, though I acknowledge that the term Indigenous is considered a more appropriate and respectful term than Aboriginal due to the colonial roots of the term. My contributions to the project was an environmental scan of Aboriginal knowledge and ways of knowing in relation to health and wellness, which is part of the first phase of the project. The purpose of the Aqua web-based resource is to create and make accessible a diverse, comprehensive collection of information focused on the strengths of Aboriginal knowledge and ways of knowing as it relates to health and wellness. And this will be to a wide range of individuals and groups. The project's key contributions to public health will be a dedicated open access web-based resource that will support students, researchers, policymakers, and communities by providing a foundation of Aboriginal knowledge and ways of knowing for further development of research, policies, and practice in public health. My methods for the scan consisted of 3 main components. The first component was a search of websites for national Aboriginal organizations that were non-health specific, Aboriginal organizations with a health-specific focus, federal government, and non-Indigenous organizations. From this, a total of 50 websites were scanned and included in my project report. The second part of the scan was a periodical database and Google search of both peer-reviewed literature, including journal articles, and non-peer-reviewed material, including reports and multimedia. A total of 89 references were included in my project report. The third component was consultation with researchers and knowledge holders associated with the Aboriginal Health Research Network Secretariat, as well as individuals from outside of the network. I was able to consult with 7 individuals in the short time frame of the scan. The purpose of the consultation was to locate additional material that may have been missed as part of the previous 2 components, as much of the knowledge is not easily found using Google due to the nature of Indigenous knowledge being held by individuals and communities in the oral tradition. Searching the literature. Search limits included published or produced in 2000 or later to March 2015, Canadian content and publications in English. You can see that the sample search terms are included in the table shown. I must reference that the term Indian was added so that older literature was retrieved. However, it is noted that Indian is not considered an appropriate term anymore. Search terms for the phenomena of interest included ways of knowing, knowledge, traditional intelligence, ethnobotany, ethnology, sociocultural, health, wellness, and well-being. Modifications were made to the database's search depending on the different phases of the search. Evaluating the results. Inclusion and exclusion criteria were developed to make decisions, which ensured that the selected material was in keeping with the project goals. The material was reviewed in consultation with Dr. Charlotte Lopi and Namaste Marsden. In order to be included, material must meet all the inclusion criteria. Specifically, material must, 1, mention at least one population of interest in the title or abstract, 2, discuss the phenomenon of interest as it relates to health and wellness, and 3, include Indigenous pedagogy. Articles were excluded if they originated primarily from a dominant worldview, including a medical or clinical focus, as they represent Western constructions of health. Emerging themes. As the environmental scan progressed, many key themes emerged in the literature representing a holistic approach to health and wellness. These themes included environmental health, traditional food and diet, mental health, language and cultural revitalization, relationships with family and community, philosophical and knowledge translation. Challenges and limitations. Aboriginal knowledge and ways of knowing is a complex subject to explore as much Indigenous knowledge is unwritten, which means it is outside of the realm of the Western academic methods used as part of the scan. Defining what would be included in the scan was a challenge, as the use of terminology is inconsistent in much of the literature. Availability of open access, peer-reviewed literature was a limitation, as much of the literature is controlled by publishers, requiring licensing agreements. As the Aqua project is going to be open access, it is a concern that much of the literature is closed access. The scan was conducted over a 13-week period as a component of my practicum. Having a longer time frame might have allowed for more key experts and knowledge holders to be consulted. Since 2012, there has been significant funding cuts to Aboriginal health-related organizations. The National Aboriginal Health Organization lost its funding in 2012 due to shifts in policy and funding. The information on their website will only be hosted until December 2017. It is unknown where the information will go once the website is shut down. The project has significance for public health as it provides valuable knowledge base for students, researchers, policymakers, and communities, which will provide a foundation for further research and policy and practice in public health. My recommendations. The environmental scan illustrates that there is quality resources available on Aboriginal knowledge and ways of knowing in relation to health and wellness, but there is a need for dedicated funding for this type of work to bring research out of the colonial discourse and into the decolonized framework of health and wellness. It is also recommended that ARSNet adds literature and materials from outside of Canada, including the United States, New Zealand, and Australia. I just want to say that a dedicated open access web-based resource has much value for students, researchers, policymakers, and communities, as it provides a foundation of Aboriginal knowledge and ways of knowing for further development of research, policy, and practice in public health. So I just would like to acknowledge Dr. Charlotte Lopi, Namaste Marsden, for assisting me with the project, and to my husband and my family who are here.
Questions, comments?
Thank you, Sara. Most interesting. The question that I have is about dissemination, or my favorite term, marketing, of that this website actually exists. Mm-hmm. The work that I'm doing with some of the schools, one particular school has a 30% First Nations population. And just some of the kind of stuff that we're hoping to do to include that group. And I was just looking at it going, oh my gosh, I need to contact Sara. I'm just wondering how the availability of that kind of information is marketed.
Okay, so right now, like, my environmental scan was the first part of the project. So the Center for Aboriginal Health Research is in the process of adding this. This is going to be available on the UVic website, which, so it's going to be hosted on the ArsNet website, but UVic actually hosts the ArsNet website on their server. So it will be available openly and publicly. We are trying to have most of the articles open access. Some of the peer-reviewed stuff is closed access, so you do need to be a faculty or staff member to access it. But I think in the past, the center has been able to, we can pay for access for individuals to have access as well to that information. Is that?
Thank you. It's okay.
Hi, Sara. Thank you. I'm wondering, in your studies of Indigenous ways of knowing, were there any particular insights or ways that, for you personally, shifted your own view of knowledge?
Oh, definitely. This project has really been a huge personal growth for me. I've learned so much, and I'm trying to think, because there's just so much I've picked up, because as part of it, I spent a lot of time reading the abstracts and getting to know what is, I guess sometimes things can be written so it sounds like it's coming from an Indigenous context, but when you're looking at it more thoroughly, you can tell that it's not actually within the Aboriginal ways of knowing. So that was one big thing that I've learned to decipher as part of the project.
One more quick question.
It's really quick. I think that this is really important, and I'm just wondering what kind of cost is associated with providing open access to these journal articles? So I guess, well, a lot of the stuff that we are adding to it is open access, but there are, as I mentioned, certain articles that are closed access. And really, that is such a huge question to address because it goes, there's just so many ways you can look at it. One of the biggest problems, I have to say, is probably that a lot of is the way academia is set up, because professors enabled the whole way that they try to get tenure. You have to have certain amount of published articles and rigorous peer-reviewed journals, and it's the owners of the journals, which are the publishers, that keep it closed access in order to make money for it. So that is a huge concern. But I think as part of the Center of Aboriginal Health Research, they're now hosting the International Journal of Indigenous Health, and that is an open access journal, and there's also other journals out there that are open access. So I don't think, it's not really an easy question to answer, but I do think that there should be more open access literature, especially because a lot of this literature is funded by public grants, such as through CIHR or SSHRC. So I hope that answers a little bit.
Thank you, Sara.